that. Thank you so much and welcome everybody. My name is Taysa Lynch and I am the Operations Coordinator for Prevention Works Vermont. I will be your moderator today. And for those of you who are unfamiliar with Prevention Works, we are a network of community prevention leaders and staff, prevention consultants, service providers, and individuals with an interest in and a commitment to substance misuse prevention across the state of Vermont. Prevention Works partners help shape how substance misuse prevention is valued in our state. By partnering with PW, you lend your commitment, your knowledge, and your action to strengthen the prevention and public health community in Vermont. Thank you. Our mission is to unify voices and to be a guiding force on policy, practice, and attitudes that promote substance misuse prevention, health, and wellness in Vermont. This informational session is about the recent cost-benefit analysis that Prevention Works Vermont contracted to take place. For a little background information, the only data that was available about cost-saving prevention provided was very outdated, 2010, and available only at national level and not a state level. With the support of DSU providing budgetary information and the use of the Vermont YRBS data, PW engaged the Catalyst Evaluation Group to provide a benefit cost analysis of substance use prevention in Vermont. I would like to welcome Ms. Stephanie. Stephanie is President and Lead Epidemiologist with the Catalyst Evaluation Group, which has an advanced knowledge of evaluation design and implementation. Ms. Stephanie collaborated with PW to collect the required data elements and apply them to cost-benefit algorithms that the Catalyst Evaluation Group employs. Without further ado, Stephanie.
Thank you, Taysa, and hello, everybody. It's nice to see some familiar faces out there. I'm pleased to be with you today, and I'm also happy to have been working with the Prevention Works Vermont team to help to provide some good information to your state on how you can quantify the importance of primary prevention in the state. And so to give you a little bit of background on this project, it's been almost a decade ago, 9 years ago, I was at a national conference and continually unimpressed by people asking me to go speak to my U.S. legislators talking about how effective we are in prevention, and they would give me the data of between $1 and $11 saved for every dollar invested in prevention. And so I go talk to my legislators, and what am I even supposed to do with that? And so I approached these individuals and said, look, we need something better. We can't just go say between $1 and $11 because 11 is really impressive. 1, not so impressive. So what is it really? And they said, well, we agree and we task you with coming up with this. And so the onus was really on me, and I realized at that time that nobody was going to do this if I didn't take matters into my own hands. And so I helped to assemble a team of professionals from across the state of Tennessee. One is a PhD level economist who evaluates federally funded programs. That was his career at ORISE in Oak Ridge. So he was the lead on our team. In addition, we had an MBA level professional, MBA, Master's Business Administration professional, and then we also had 2 coalition professionals, myself being an epidemiologist, to help create this report. And so we did it 2 ways. The first is that we actually hand calculated the expenses associated with substance misuse in our communities. We did a cross section of 3 different counties to make sure that we had something that was reliable and had the validity to stand up to scrutiny. And so we conducted this study in 3 different counties in Tennessee and calculated by hand. So that's ended up being about 20,000 hours of work that went into that. It was extraordinary amount of work, such that no local coalition could ever actually fund that type of project. And so what we did was go and do an extensive literature review to some studies that had been done previously. One was funded by SAMHSA, Substance Abuse Mental Health Services Administration, and another was funded by the Center for Addiction and Substance Abuse at Columbia University. And so those were the two most widely utilized, most widely cited, and the most reputable sources of the cost benefit of substance use prevention, specifically related to primary prevention in the country. We found those to be the most reputable. Those are the ones that we used as the foundation for our algorithm that we ultimately developed from our study. When we created the algorithm, we were able to develop within 0.03% margin of error, which is extremely narrow if you're a statistician. And so we felt confident moving forward using the algorithm in lieu of actually forcing people to hand calculate the expenses that local governments pay related to shoveling up the consequences associated with substance use in their communities. And so there are a few key factors that go into this analysis. One is that we're focused only on taxpayer funding. There are so many different avenues that you could approach this type of study. So especially when it comes to quality of life and future earnings for individuals, that felt to us a bit in moving into the treatment sector, and we wanted to keep our lane specifically within primary prevention. And so that's why we stayed only with taxpayer funding. And that allowed us to move forward with the algorithm. So there are some assumptions that must be made with this type of report. And one of those big assumptions is the idea of community contribution, in that we are measuring contributions to change and not attribution. And so basically what that means is, while we are taking into account the budget of prevention works in the state of Vermont, we cannot take credit for all of the reductions in prevalence of substance use across adolescents, because we are not working in a silo, and there are lots of other protective factors across the state. And so this is a contribution analysis and not an attribution analysis. We will not attribute any of these findings directly to prevention works. Rather, we are contributing the changes to primary prevention in the state. And so that's a pretty major differentiation that's important to understand as we move forward. Thinking about the benefit cost analysis, for every dollar invested in prevention in Vermont, there is a return of $7.03 in savings in taxpayer funding. This at the state level is significant, very significant. We also know that the level of effectiveness of primary prevention increases the more local we take the dollars of investment. When we invest dollars at the federal level, we have a very, very small rate of return. When we invest them at the state level, we have a little bit larger rate of return, but when we invest them at the local level, we have a significantly higher rate of return. Just to give you a benchmark, in the state of Tennessee, we have 95 counties. 86 of those have primary substance use prevention coalitions. In our state, for every dollar invested in primary prevention, we save $4.60. And so the numbers for the state of Vermont are quite high. We do want to just give one note of caution, is that we can only use the data that are presented before us, that we have access to. The data that were accessible based on prevention expenditures at the state level were for 2021. So you don't have to be an epidemiologist to know what was going on in our world in 2021. We were coming off of a pandemic, a global pandemic. And so we will forever have an asterisk beside our 2020, 2021 data. And so that is just, we can't stop researching. We can't stop our lives. We can't stop what we're doing just because we have an asterisk next to our data. I still feel very confident in the figures. And a $7.03 return on investment is very strong. for the state of Vermont, for any state, but that's what it is for the state of Vermont. And so the annual cost of prevention, the expenditures, was $6 million in 2021. And so those are the combination of federal and local foundation dollars that funded primary prevention across the state. And so what that means is that when we apply our algorithm, that's what helps us to determine how much money was spent shoveling up the consequences of substance use. And in the state of Vermont in 2020-2021 fiscal year, it was $328 million. We assess the audits from the state comptroller's office to pull the figures that we need. We always use the audited expenditures and not the budgeted expenditures. That's also important. So we know that through the prevention efforts in the state, for every dollar invested in primary prevention, there's a savings of $7.03 in taxpayer dollars. And so there are a lot of different ways that you can say this. We've provided some talking points to Prevention Works Vermont. Sometimes people will say for every dollar invested, you save $7.03, or the return on investment is $7.03. There are lots of different ways you can put it into a percentage, but then it sounds kind of crazy when it is that high, because that would be a very significantly high return on investment. So usually in those dollars is what we're looking at. This shows the cumulative change in prevalence of substance use. To be able to run the algorithm, we have to apply the raw numbers of the survey to the population. We don't do, as statisticians, we don't do math with percentages. And so we translate the Vermont Youth Risk Behavior Survey to the raw numbers, and we do our math with the raw numbers to measure the overall change in prevalence of use. In communities where we don't have a reduction in prevalence of use, we don't have a return on investment. And so we oftentimes have people who come to us and say, hey, can you run the algorithm for us? And we say, well, we can, but you're not going to show a cost savings. Do you still want to do it? Sometimes people do want to continue through the algorithm, even if they don't have a return on investment, because they want to take that to their local governments to say, this is why we need to invest, because this is how much our county is spending because we are increasing in adolescent prevalence of use. But Vermont has some reductions in prevalence of use between 2019 and 2021. Of course, we have that caveat that this was during the COVID-19 pandemic, but nationally, the trends that we are seeing are our adolescent prevalence rates are not shooting up like we might have expected. So they're staying, generally speaking, in most states that I've observed across the country, they're staying below the levels that we had pre-pandemic. And so I do feel confident in the reduction in prevalence of use across alcohol, tobacco, cannabis, and prescription drugs. So in 2021, you can see the reduction rate across those four substances was 26% reduction. And so the burden spending in the state of Vermont was just over $164 million. And so as we apply the algorithm, the savings in burden spending saved over $42.7 million. And so then we've got the prevention budget applied there. And those are the prevention expenditures. And then the benefit cost ratio is negative $7.03. And so that's how we come up with the burden spending. That's how we apply it to come up with the cost ratio. And that leads me to give you all time to ask any questions that you might have.
Stop it.
So let me, as you all are thinking about some questions that you might want to ask, I'm going to keep the PowerPoint slide up just in case anybody needs to go back to any of the figures. But here's how I have used this personally. Here's how we've used this in the state of Tennessee to leverage support for primary prevention. In 2015, I went into our Tennessee General Assembly and I testified on behalf of a bill that would have allowed local communities to add a litigation tax to court cases that would create a funding stream that would go to primary prevention in local communities. The litigation tax is just court cost. So if you get a speeding ticket, you pay court cost. You might pay $35 extra on top of your ticket, and then that's divvied up into different areas in the community. And so we were trying to get that approved in the state of Tennessee just for our county to be able to do this. Not only did it not pass, it didn't even make it, our bill did not even make it out of subcommittee and to even get to committee. And when I went in, I testified and I was talking about the number of lives lost to substance misuse among youth in our state, the number of families torn apart, how grade point averages were decreased in our schools because of substance misuse. But at the end of the day, while I felt like I walked in with a really compelling argument, that's not what our legislature cared about. They cared about money. And so over the course of that next year, when we're thinking, okay, what do they really care about? They care about taxpayer dollars. How do we make what we do in primary prevention tie to what they care about? The only way we could do that is a cost benefit analysis. And while I was really tired of going to talk to them about this issue because I felt like we were going nowhere, we had been working on it for 3 years, and I was really ready to give up. And my colleague said, Steph, we can't stop here. We've got to do this. We've got to get this passed. So between legislative sessions, we did the cost benefit analysis. When I went to testify on the same bill that was reintroduced the next year, I walked into subcommittee and all I had to say is what I've said to you all today. For every dollar we invest in primary prevention in the state of Tennessee, we've saved $4.60. And in Anderson County, Tennessee, where I worked at that time, for every dollar we invested in primary prevention in Anderson County, Tennessee, we saved $17.73 in taxpayer spending. All of a sudden, I had people listening to me. And all of a sudden, our bill sailed through subcommittee. It sailed through committee. We only had one dissenting vote on the entire General Assembly floor that year. And not only did the legislature want us to be able to do that in Anderson County, but they opened up and amended the bill so that every county in the entire state, all 95 counties, had the ability to add this litigation tax in their communities. Our bill was up to $25 per court case. In our county, so it's an opt-in, it was an opt-in language. So our county said that they were only going to do $5 per case and exclude juvenile court and exclude cases of violation of probation. We did not want to use our litigation tax that would put people in jail. And so we had a couple caveats with that. But it generates about $3,000 a month for that coalition in unrestricted funds. And so it was a good revenue stream for primary prevention in our state. And Burlington Partnership, I see you have your hand raised. Go ahead.
you.
Oh yeah, thanks so much. So I'm Mariah. I work in Burlington. Thank you so much for this. This is so exciting to have this data. A quick question for you on one of the previous slides. I think you had there was a number of 328 million that was spent on shoveling up the consequences of substance use from okay, great. That number, is that maybe the slide just went too fast. Okay, so that 2020 to 2021, is that the fiscal year 2020 to 2021, or is that over the course of 2 years?
No, that's the state fiscal year.
Okay.
The 2020, 2021 state fiscal year.
Okay, thank you. That's helpful. So what I was just thinking about, and this is more like for the group, is when we previously had a cost benefit analysis done years and years ago on the consequences around this, the thing that stuck out to some of our legislators was that we were spending essentially 20% of the total Vermont budget on shoveling up the consequences of substance use, right? And it looks like, I just did a quick analysis, it looks like it's still about the same. So we're still at, if I'm correct, it looks like we spent 1.6 billion of state dollars in 2021, and that's still about 20% of that. So we're not making any effort unless we put more money into prevention, I think, to reduce that those preventable costs.
Thank you, Mariah. Appreciate you for making that point. I also think that it's interesting and validating that the percentage of the expenditures of shoveling up the consequences are similar between two different entities doing a cost benefit analysis. And so I think there have been some questions of the validity because we've used a COVID year, but I think that really negates the concerns because we still have two very different comparisons. And this one, the 328 million, comes from our algorithm. So I think that lends a little bit of validity. If you're out in the community, you're talking to people, that could give you a little bit more leverage.
Any other questions? Ooh,
Go
I
ahead,
thought-
Catherine.
You had mentioned there would be talking points. Is that something you're sharing or Prevention Works? I just think I'm like, yeah, I kind of get this, but I sure as heck wouldn't try to repeat this. And I work for the state, so it's really not my role, but I'm just wondering when those come into play, those talking points for people like me who kind of get it, but don't totally get it.
Great. I'm going to let Taysa, you handle that question. Those have been provided, and so I'll let Taysa address that.
I'm fairly certain we're able to send those out, so I can send those to the group and I can post them online.
Thanks.
Of course. Any other questions? I'm not seeing any. Stephanie, thank you so much for all the work you and your team put into this project for us, for our little state over here. We look forward to using the results.
It was our pleasure. Thank you all for reaching out, and I can't wait to hear about all of the mileage that you get out of having these data.
Thank you so much. Prevention Works, thanks everybody for joining. Have the best day, and we'll see you soon.
Have a great day, everyone.
Bye.
Yay.